Professionals who've had their licenses revoked were still hired to treat veterans. New at 5:30, Action News Jax investigator Justin Gray is live in Washington, D.C. Justin, federal investigators say VA policy prevents it, but VA staff hired them anyway.
Yeah, these employees were flagged by medical licensing boards for bad behavior. VA had access to that information. In some cases, they chose to overlook it. In others, they missed it entirely. A VA registered nurse who has 3 separate DUI convictions and assault and disorderly conduct convictions was flagged by a state licensing board as a serious risk to public health, but still works for the VA, where officials decided this was, quote, an ethical concern rather than a patient care concern. It's just one of the cases internal government auditors looked at where Veterans Health Administration facilities hired or continued to employ doctors and nurses disciplined by state licensing boards.
Some of them were very egregious and would affect patient care. And did affect patient care, in fact.
VA is required by its own rules to check with state licensing boards before hiring doctors or nurses.
They have policies in place, and we just found that they were not following those policies in a consistent way.
In one case, a nurse voluntarily surrendered his nursing license due to abandonment of patients, but VA hired him anyway because the license wasn't officially revoked. In another instance, the state did revoke a nurse's license because of, quote, patient neglect and substandard care, but VA inadvertently overlooked it.
In some cases, they just overlooked the information, and in some cases, they misunderstood the policy.
VA is now taking new steps to deal with this problem. They did a full review of all 165,000 healthcare providers to double-check their license status, and they've agreed to set up annual training about licensing for hiring managers. Reporting live in Washington this evening, Justin Gray, CBS 47 Action News Jax.